Human resource management is sometimes thought of as being completely separate from the clinical processes within hospital, and sometimes when we consider HR IT systems, they're considered separately from the broader agenda around e-health, which tends to focus on clinical improvement, patient care and safety and so forth. But our argument is that human resource management, effective human resource management, and the information systems that support that are vital for underpinning strong health systems and critically for supporting smarter, more responsive health systems. Gaps in information about who is working on what jobs at what times, what categories of staff they are, how they're being paid, where there's a new area of need that may need filled, sometimes very quickly. It's essential. It's essential to have that information in order to improve the efficiency and effectiveness of hospitals. And we believe that this is, in fact, we know from our research, this has been under-researched as a topic within eHealth, and we feel it's a legitimate source, a topic for research in eHealth in the future. This particular project also is relevant for eHealth because it's trying to understand the processes through which technologies are implemented in healthcare systems. There has been a lot of research looking at organisational change and implementation factors for IT systems in healthcare, which has given us a lot of theories that allow us to interpret things that can go right and can go wrong. And an HR system scaled certainly not only within a hospital but also across a nation, as in the case of this project, provides a great opportunity to test some of those theories and also to generate new ones. We know very little about the organisational context of HR systems or HR processes as eHealth researchers. So understanding how systems are conceived, how they are implemented and how they change behaviours and how those changed behaviours or processes influence patient outcomes will be a new and interesting theme of research.
Research on information system innovation focuses extensively on the design, development and implementation of core business information systems such as ERP packages or supply management systems. Much less is known about the processes surrounding the design, development and implementation of support business systems such as human resource systems. However, if we are serious about the role that human resources play in today's organizations, for example, if we think about the importance of nurturing innovation and creativity, then understanding the IT tools that manage these resources become much more important. Arjan's research focuses on examining the development, implementation and use of human resource information systems in a particularly complex and challenging context, health organizations. Within health, we know a lot about the design, development and implementation of core systems that support the clinical functions. For example, research examines the role of user involvement during the design stage, the political and cultural factors that shape development, the technology characteristics that encourage adoption and facilitate implementation. We also know a lot about the outcomes of clinical systems use in terms of cost effectiveness and improved patient care in different contexts. Nevertheless, similar with information systems research in general, there is too little focus on human resource systems in health. What facilitates their development and adoption? Does the user play an important role during design? Do cultural and political contexts matter? What are the outcomes of human resource systems implementation and how can we measure them? Arjan's research also has significant implications on human resource data standardization. How will the existence of different data formats shape the implementation process? Is standardization really likely to facilitate adoption? And last but not least, how is such standardization achievable?